Hi, welcome back to Quake Clinic. How are you today? Okay, well, I'm glad to see you. And I understand that you're here for a dental exam today? Okay. Yeah, do you know about how long it's been since your last oral hygiene checkup? Whether that was an orthodontist or a dentist, just any dental work you've had done that you can remember? Okay. Okay. Well, it sounds like it would be a good idea then for us to just take a look at your mouth and see if there's any problems that might be visible to the naked eye, so that we don't really need to get in there with any x-rays or anything too serious, since we just are meeting for the first time. If I do see anything that would warrant the need for further treatment, I will let you know what your options are and we can go from there. But today we can just do a cleaning and I can peek around and just get a general sense for your oral health, and if there's anything that we need to be cautious of moving forward. We can talk about some of your dietary habits that might be impacting the health of your teeth and mouth. And if you have any questions or anything comes up as we're going along that you think you'd like to ask me about, feel free to ask me. Okay? Okay, well, as usual, I'd like to start just by listening to your heart rate, seeing your breathing, making sure that we have a nice healthy base to start off with, and that there's nothing seriously the matter at the moment that might get in the way of our examination. Okay? Alright. So let me see here. First, I'm just going to place the stethoscope on your chest. Okay, and here we go. And I'm just going to listen to your heartbeat. Sounds good. Just move. Okay. One more spot on the front. Okay, excellent. And then I'm just going to reach around to your back. And can you take a deep breath for me, please? Excellent. Okay, and again. And again, please. Good. And one more time for me, please. Okay, excellent. Sounds great to me. I don't hear any fluid in your lungs. I don't see any trouble, or hear any trouble rather, with your breathing or any irregular heartbeats. So I'm just gonna feel your pulse now. If you'll give me your arm, please. Thank you. And I'm gonna watch the clock here for a moment. Alright, it's a little fast. You feeling nervous? That's understandable. Well, luckily you're here with me, and we're in a very, very safe environment. And I know you, so nothing bad's gonna happen. Do me a favor and wiggle your toes around a little bit. Yeah, just sort of take a nice deep breath. Just relax, remember where we are, that everything's okay, and that if anything were to happen, I'm right here, so nothing ultimately horrible would happen. You're being taken care of, absolutely. Yeah. So take just jump right in and start taking a look around in your mouth. I'm gonna put some gloves on. Just because my fingers are gonna be feeling around in your gums and on your teeth, and obviously we want to be hygienic, so these will do the trick for that. Okay, so if you can just open wide for me, please. Good. Have you had any wisdom teeth? Okay. Okay. Is there any tenderness when I do this? Okay. And on the bottom? Okay. Good. Yeah, it's kind of strange. A lot to do with oral hygiene, and I guess not the hygiene so much as just the arrangement of your teeth and whether or not you get wisdom teeth, and if you have a host of other potential dental issues. A lot of that has to do with your genetics, actually. So, not that I encourage everyone to go around blaming their family for any issues they might have. There's definitely a lot that we can all do for prevention, and technology has come so far that a lot of the problems that would have probably been a horrific thing to find out about yourself before are really treatable now and not so scary anymore. So, can you stick your tongue out for me? Okay. Okay. Okay, you can put it back in. And so, have you been feeling any discomfort eating certain foods? Anything hot, cold, very sweet, a lot of chocolate or gummies? Okay. A little bit of a sensitivity. Oh, okay. Okay. And do you know if you've had any cavities before? Okay. Well, overall, I'd say I'm gonna have to, get in there with my tools a little bit, poke around with something that's a little finer and more able to get into the crevices of your teeth than just my finger, just to see if there's any actual tenderness that we need to be worried about, anything that might show signs of tooth decay or issues with your enamel, anything like that. So I will grab my dental kit here in a second, but at the moment, from what I can see, everything is looking fairly healthy. You do have a little bit of a crossbite going with your upper and lower teeth, so essentially that might make it a little more difficult to chew meat or something that's a tougher texture when you have to take a lot of bites to grind that down into pieces that are swallowable, I guess. So that might be something you've noticed. It might not. It's very slight. Essentially, instead of having an overbite or an underbite, your teeth are just slightly, they don't quite line up from left to right on either side when you bite down. They're a little bit shifted off, but it's hardly noticeable, and it's definitely not something that I would foresee causing you any long-term issues. On the other hand, your gums look pretty good and healthy. I know that most people don't floss that often, so I don't really judge, and I find that it's kind of pointless to ask because most people don't tell you the truth anyway. But they do look relatively healthy. I wouldn't be too worried. You might have some bleeding when you floss, but I don't see any signs of gum disease or anything like that looming on the horizon from what I can just see with my own eyes. So yeah, if you don't have any questions for me right now, I will grab my tools and take another look and sort of use my mirror and pick to get into the crevices, especially in your molars where sometimes food gets stuck, and if we don't do that great of a job brushing or flossing, then that food can get stuck in those crevices overnight or for long periods of time and start to cause damage to the tooth. And it can be very minimal, and it's just better if you catch it early on, because the longer that you let it go, the more likely it is to turn into a deep cavity. And if we can shave it down and fill it before it gets to that point, and it's just something that you're aware of, and you take a couple extra minutes when you're brushing to prevent that from spreading or becoming a bigger problem, it's sort of the best route overall, and you can keep your teeth healthiest for the longest amount of time that way. Yeah. Sorry. Yeah, no, I know, I've known people who they just felt doomed from the beginning with their teeth and never really went to the dentist, and they just sort of had it in their mind that they were gonna just get veneers, get completely fake teeth when the time came. They didn't do much to take care of what they had, and if you have the resources for that, I suppose, that's fine, but I still think most people prefer to keep their own teeth, at least in my sample pool here at the office. I would say most people are trying to keep their teeth. Okay, and tell me if at any point in time this feels tender. I'm just taking this pick and tapping the center of your teeth back there. Okay, coming around to the front. Okay. Did any of that feel strange at all? Painful? Okay. Okay. Let me see there. Yep. Okay. Yeah, I see that. Tell me, do you ever get, some people call them canker sores, mouth ulcers, some people just call them sores. They're on the inside of your mouth, and yeah, sometimes they can definitely be agitated or more likely to come up if you're eating a lot of junk food, as we would call it, sweets, sodas, anything that has a high acidity level to it, a lot of orange juice, things with a lot of sugar. those have been known to increase the frequency that people who get ulcers, mouth ulcers, have them, but there's no actual medical science proof so far that that is the cause, because there are people who have completely different diets that should not be conducive to getting mouth ulcers whatsoever, if that were the case, who get them sometimes even worse than people who do have access and eat all of those sugary foods. So that being the case, sorry, I'm a klutz today. That being the case, there's yet to be a single theory as to why people get them, but it is definitely true that with most things related to your health, diet, exercise, and sleep are all incredibly important to dental health as well. So if you are having any issues with getting, let's say you're eating a chip and it slices the inside of your mouth, or you bite your cheek while you're eating and that turns into a little cut and becomes a mouth ulcer, that's another way that people might recognize those. They can be very problematic for some people and not such a problem for other people. But I would say if you are having any of those issues, if it's infrequent, just whenever you feel one coming on, you can start to alter your diet for a couple days, drink more water, try to get more sleep. You'll notice you'll probably be stressed when you get one. That's another factor that they found really influences getting mouth ulcers, is your levels of stress. So it's completely normal. A lot of people get them, more than you would think, and I don't think that a lot of people talk about getting them. So it's nothing to be embarrassed of. It's something that we're still figuring out in the science world as well. So, but there are a few things that we can do if you happen to get them frequently. There are medications I can prescribe you that are sort of like a grainy ointment that you would put over any mouth ulcer, sort of at night before you go to bed. Sleep on it, and it helps heal the ulcer. So it should cut down on the amount of time that you would have each one for. Something like that. Yeah. There's not much else that I could prescribe, just because they haven't really invented anything, or they haven't figured out what the issue is yet well enough to prescribe a medication that would prevent them. Right. Let me see. Yeah, I would say just, obviously do your best to remember to take care of yourself and get some good sleep, eat some good food sometimes, drink some water. And if you're already doing all of those things, that's another time where I would highly recommend just having some of that medication and using it as needed. Yeah. Okay. Well, if you do decide that that's something that you'd like, on the way out, just let the receptionist know and they'll bring a prescription to me. I'll sign it and get it right back out to you. Okay? Great. Well, I guess the next thing that I'd like to do is start, well, actually, let me use my flashlight to look around just a little bit more before I start your teeth cleaning. If you are having a little bit more of a sensitive mouth, I just want to make sure that I'm not missing anything and I'm not going to hurt you while I'm going through and brushing your teeth and, cleaning in between your teeth. So if you don't mind, I'm just going to have you open up again. Okay, and I'm just going to look, and I'm going to use my mirror to sort of pull your gum away. So choices I'm making you make. Good. Just gonna use my finger here. Open this. Here we go. Okay. Can I get you to tilt your head back slightly? Thank you. Okay. Okay. Good. Looks good. Okay. Okay. Okay, cool. Alright, well, let's get started with our cleaning. I have here, I'm actually almost out, but this is just a flavorless, odorless little tincture that I'm gonna have you tilt your mouth open for me. I'm gonna put a couple drops of this on your tongue, and then when I do that, I'd like you to close your mouth and run your tongue along the inside and outside of all of your teeth as best as you can, okay? Okay, here we go. Okay. Alright, there you go. Yeah, and what that's actually doing is coating. There's a special chemical in there that will find a certain sort of bacteria it'll have a chemical reaction with, so that way I can see exactly where you have a lot of buildup in your teeth. So when you run your tongue with the liquid across your teeth, it'll collect in the areas, like in the cracks and places where you might have some buildup, anything that might have been a neglected area, and it will turn that area red. Yes, so you kind of are gonna look like a vampire right now. Yeah, but don't worry, I'll get you fixed up. Okay, open on up. Alright. Okay. Okay. I know this is always the awkward part as the patient because you can't speak. And I feel like most people, not all people, but a lot of people, like to fill the silence when they're in the presence of someone that they're not that comfortable with or they don't know that well. Definitely takes a special sort of bond to be able to be comfortable in silence with someone, I think. And the dentist's office is not for most people the place where they feel that way. So I definitely like to encourage my patients to close their eyes and just try to feel relaxed while I work. And if you prefer, I can talk a bit, and if you don't, I can be quiet. I will stick to relevant subject matter then. Speaking of which, are you left-handed or right-handed? Okay. And I ask because there's a tendency when people are brushing to miss a certain window of teeth, and it mirrors itself on either side. So the area is this sector. It's not right at the front of your mouth, but off to either side. And people who brush with their right hand are more likely to miss these teeth. And people who brush with their left hand are more likely to miss these teeth because it's just unnatural to be like pulling your toothbrush so far back like that, and people don't really consider that you're sort of skipping an area by accident. So I like to just let people know that that's a problem area, and on most people you'll see that the most discolored area, unless they've whitened their teeth, will be at the corners there on one side or the other, if not both. Yeah, so it's just good to know, and then you can, when you can, switch hands and brush with the other side or work it out somehow. This is looking really good, by the way. Okay, if you don't mind, there's a rinse station right next to you. Yeah, just take some water and swish. Good. Perfect. Yep, and you can spit that out there. Okay, got my hands in her pick now, and what I'm going to do is go around and sort of just poke gently at your gum line in between the crusts of your teeth to see if there's any signs of dental diseases that I might not have seen before. Now that all those crevices are clean, I'm not expecting to find anything, but I still want to be thorough. Okay. Good. 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 Okay. Can you open your bottom, please? Okay. Yep, just keep that tongue up for me for a second. Good. Okay. Good. And can you raise your top for me? a little bit of an examination of your jaw. So I'm just going to put my hands right here next to your ears and just feel around a little bit under your chin. Okay, and if I press right here, how does that feel? Okay, and is the pressure on the left side equal to the pressure that you feel on the right side? Okay, good. And can you open your jaw for me slowly? Okay, and you can close it. Good. Okay. Okay. Oh, that feels okay. Okay, perfect. Alright. Well, the next thing that I think we should probably do is brush your teeth. I've got this toothbrush here for you. And some toothpaste. Do you like just a classic mint flavor? Okay, I can do that. Alrighty, open up. Okay. Alright. Okay. Looks good. This part's always difficult for me. Yeah, they do actually teach you how to brush someone else's teeth in dental school. We started off on mannequins, but ended up on real people. Luckily, though, it's not like cutting someone's hair. You're not bound to damage their self-esteem when you're just brushing their teeth. Most people just find it really relaxing to not have to worry about it themselves. Which I guess I don't blame them for. I'd probably let someone brush my teeth if it were an option. I'm just so tired at the end of the day. I just usually listen to music or the news or something while I do my routine getting ready for bed, so it's not that bad. Okay. Looks good. Can you swish again for me? Thank you. Perfect. Okay, and I'm just gonna use the flashlight here again to check and see if we've got all of that red residue away from your teeth. Okay, let me see here. It's an definitely looks good, but we still have to get it off your tongue. So if you can just gently, you don't have to force it. I'm not going to stick this so far back. I don't know if you have a sensitive gag reflex, but I'm not going to go all the way to the back of your tongue and make you uncomfortable. I'm just going to get sort of from the middle portion down. So if you can just gently lower your tongue for me. Okay, let me just rinse this. And again. One more time. Excellent. That wasn't so bad, right? Okay. Put this back in. Okay. So I think for the most part we have covered all of our bases. I did want to ask though, have you been utilizing anything at home aside from just a standard manual toothbrush? Okay. And do you feel like you've been happy with your level of clean and everything? We didn't really talk about oral hygiene in the sense of how you feel about yourself. I can tell you, from a medical perspective, your mouth is healthy. Everything looks fine. I don't see any issues that would make me want to send you to get an x-ray because, as you probably know, radiation is pretty serious, and even making you get an annual x-ray without reason is kind of silly exposure to harmful rays. So with that in mind, I definitely don't want to impress anything that doesn't need to be done, but that being said, I'd like to know how you feel about your own dental health and if there's anything that you're unhappy about. For example, do you ever feel like you have issues with bad breath or anything that makes you uncomfortable about your smile? Just anything that is an issue. And if some people have, we already talked about mouth ulcers, but chapped lips, anything with your jaw when you're eating that might be uncomfortable. Okay. Have you ever had braces? Okay. Okay. Well, I didn't notice any particular strong smell or foul smell from your mouth. Nothing that I would be like, oh goodness, we should, get you onto a prescription mouthwash or something. But you can always experiment with changing your toothpaste. I know people tend to fixate on one that they really like and buy it over and over, but sometimes the mouth reacts better with just a different formula makeup of the toothpaste. So you can always switch it up if you needed to or wanted to. And then I also wanted to recommend, they make these great, have you seen these? Yeah, these are, I keep a pack of these in my car and I keep some at home. They're great for, if you're at work and have lunch and then you're coming back to work or something and you need, you have food in your teeth. They have a really nice little pointed end where you can use to get food out of your teeth, similar to the way that we just did with the dental toolkit. And they also have a flossing bar, so if you'd eaten something really dense that is bound to get stuck in the tinier cracks of your teeth and your gum lines, and you don't want to leave that sitting there and make you more prone to cavities in the long run, it's also great to have these just on the go, and you can really do a lot for your oral health and your breath by removing extra buildup after a meal. It's actually something that some people do too when they're quitting smoking or trying to eat less. Just after you eat, this becomes your ritual of, cleaning out in between your teeth, and you can have the pick with you, and or even if you're just trying to be a little healthier. Everybody has a different walk of life and reason, but whatever it is, casual or not, these are fantastic, and I would definitely recommend investing in some. They sell them in packs of like 200 at the drugstore, and they're really not that expensive. The only thing that I suggest is that you make sure the flossing part of whichever brand you buy is something that you think wouldn't be painful. Sometimes they use like a flat, thick floss instead of a round, string-like floss. So it's just something to consider based on your own sensitivities. And then after you floss out your mouth, whether it's for hygienic reasons or otherwise, make sure, or if you're looking to continue the good health hygiene of your mouth, you can swish some water around in your mouth afterwards. A lot of bad breath also comes from just not drinking enough water and cleansing your mouth. So that's another great thing to do after lunch, and especially after you floss, is to just have a final glass of water, or even just a few sips of water to really clean everything out. You'll have a really nice and fresh mouth all day long, and it'll be great for your oral health as well. So just a suggestion if that is something that's been concerning you. I know everyone gets worried about their oral health. Nobody wants to have bad breath, and I think people get very concerned about it, and again, don't talk about it that much. Yeah. Okay, well, the last thing that we need to do before we part ways today is just to make sure, as usual, that your patient paperwork is up to date, and if there's anything that you wanted to schedule as far as another treatment from here on out, we can get that in there for you too. Okay, so if you can just look at this monitor and tell me, is everything on this screen correct insofar as your name and address and birthday? Good. Okay, so let's see, today is, okay, and we did a dental exam. Tenderness. Okay, and then we cleaned your teeth. anything else that you wanted me to put in your file for any treatments you're considering? Okay. Yeah, absolutely. We don't force you to do anything, and this would all be completely up to you. You're welcome to make a call over here any day if you decide you change your mind and you'd like to book an appointment for any reason to talk about changing anything or just anything you might be unhappy with. We do the teeth whitening. Yeah, we do have either a 4 or I think it's 8 or 9 weeks that you come for an hour session. And over the course of that time, it brightens your smile. It's different than like the Zoom one-time whitening or anything like that, because it's easier on your teeth. One thing that people don't often know about getting your teeth whitened is that it does damage the enamel on your teeth, and for some people it's just not a good idea to go all in and get that really powerful one-time whitening because it does so much damage to their teeth. I would say that you could be a candidate for that, but just since you're so young, the longevity factor, I would just suggest taking it slower if you did want to ever go into that route. But I think your teeth look perfectly natural at the moment. There's nothing that I would say sticks out as a horrifying, something you should be embarrassed of or anything like that. I think that nobody would ever look at you and think anything strange. You have a beautiful smile, so yeah, I would just think about it. Don't rush it. Okay? Alright. Okay. Well, as usual, it was an absolute pleasure seeing you. Did we talk about everything that you wanted to today? Okay. Yeah, well, if you end up having any questions or wanting to go back over anything, just give me a call. If you want that prescription, just feel free to ask the receptionist. Okay? Alright, well, you take your time and get ready, and I will see you the next time I see you. Drive safely, and have a great rest of your day.